So the three key points to be gleaned from our population-based investigation are: one, the incidence of vascular graft infection following arterial aneurysm repair in the population is low. Two, despite past controversies, there is still really no significant difference in the rates of vascular graft infection following open surgical repair compared to endovascular repair. And three, though infrequent, the seriousness of vascular graft infection remains apparent through its heightened morbidity and mortality, which may be attributed to the increasing complexity of patients who are undergoing arterial aneurysm repair in contemporary times. When stratified to the repair type, the incidence at 5 years was 1.4% for endovascular repair and 2% for the open surgical repair.
This video content is copyrighted by Mayo Foundation for Medical Education and Research.